Good morning. My name is Laura Albillos and I am a doctoral candidate at the University of Oviedo in the Department of Functional Biology. First of all, I would like to thank the organization for considering our work of enough quality to be exposed. The purpose of this systematic review is to analyze the effectiveness of intermittent pneumatic compression, hereinafter IPC, on the recovery of muscular fatigue after an eccentric exercise. Training programs should have an appropriate balance between exercise and recovery. When this balance disappears and we do an incomplete or inadequate recovery, increase the risk to suffer muscle fatigue. We will define muscle fatigue as a transient decrease in the capacity to perform physical actions. So the objective of a recovery process is to eliminate this fatigue as soon as possible, to enable athletes to train in a correct physical condition. Over the years, multiple and varied techniques have been used with the intention of accelerating this recovery process, such as hydrotherapy, therapeutic massage, electrical stimulation, or vibration therapy. And the question is whether IPC could be another one of those effective techniques. To obtain the studies, we used the following electronic databases: PubMed, Medline, Embase, Cochrane Central Register of Control Trials, Web of Science, Scopus, Sport Discuss, and CINAHL. And there, we selected studies analyzing the effects of IPC on exercise-induced muscle damage, and we exclude studies which do not report performance or fatigue outcomes, case reports, case series, or reviews. In the selected studies, we look for the following data: sample size, gender and age, exercise-induced muscle damage protocol, study groups based on the recovery strategy, outcome measures and assessments, and finally, the main results from each of them. The methodological quality of the trials was assessed using the Pedro scale, and it resulted that 4 articles were of good quality, 9 were fair, and 6 of poor quality. Finally, we work with 19 studies and with a sample of 368 subjects, 276 males and 92 females, from different disciplines like university students, lacrosse, field hockey, or ultramarathon athletes or cyclists. The number of the sample ranged from 7 to 73, and the average age of participants varied between 17.7 and 57 years. Now, here we have the principal intervention characteristics and control conditions. 11 papers examined exclusively males. Only 1 examined exclusively females, and the remaining investigation assessed a mixed-sex sample. All the studies specified that they employed an exercise protocol, except 2 that they used a competition and 1 where it is used training in the subject's respective sports. In the majority of the cases, treatment had been administered after the exercise-induced muscle damage, but there are some special cases where subjects receive it between 2 exercise-induced muscle damage periods and another one where it is done before the exercise. Control group do a passive rest in 10 studies, while the remaining papers perform an IPC sham. IPC interventions of studies range from 15 to 60 minutes with a pressure of between 50 to 80 millimeters. Those tests were performed from 1 to 7 days. And to conclude, change from baseline to the last available follow-up were measured by different testing: fatigue score with Borg scale, pain score with visual analog scale or algometer, biochemical markers as 4-hydroxynonenal blood lactate concentration or creatine kinase concentration, performance testing as squat jump, vertical jump, contour movement jump, or functional threshold power, range of motion, electromyography, and motivation with Likert scale. Some studies reporting between group effects on muscle fatigue show a statistically significant reduction both in visual analog scale testing and performance testing. And regarding pain, there are also reductions both with algometer or subjective scales. We can find some examples of that on the table resume, like Hippie and Hoffman articles where it is used a visual analog scale and results show a decrease of fatigue on the IPC group. Some other articles show a reduction in biomarkers blood as we can see with Roberts' papers where there is a significant difference on immunoglobulin A between IPC and control group. On the other hand, there are 7 studies that do not find a statistically significant difference between conditions for any outcome. Because of that, we will now go on to see what happens when we face the different points of view of the articles. First of all, as I've said, there are some studies that found benefits on muscle fatigue parameters comparing IPC with control group, and there are others that in spite of they also measure the same parameters, they don't find any significant result. We have to consider that those testing depend on the sensation of the subjects because they are very subjective. And we have also to highlight that positive results only appear in testing done immediately after to receive IPC. If we focus now on pain, we could see the same. Some authors don't find any significant results, and although others do, those parameters are very subjective too, and good feelings did not give in time. Finally, regarding muscle inflammation, there are more papers where results are inconclusive than articles that found positive results. Having said that, we conclude that the IPC effects for recovery are inconclusive. Hence, the current evidence is too limited to use IPC as a recovery method, and there is need more investigation on this file. Because of me, nothing else. I appreciate your attention and I remain at your disposal to resolve any question. It has been a pleasure to share a part of our work with you. Thank you very much.